Hi everyone. As we know, over the past century, the great progress made in the healthcare for a new and existing technology relies on electrotechnology. Following the discovery of the intelligent ultrasonic energy, the greatest advance have been made into the ultrasonic device and the treatment for the patient.
So, today I am Amira Farhani binti Abdul Fakar from a Bachelor of Science Physics, University of Science Malaysia US. We present to you about the ultrasonic Ethicon endosurgery generator G11 that for cut and seal vessel to control the surgical bleeding. For introduction, the most recent advancement in the area of the ultrasonic technology is the newly developed next-generation ultrasonic energy device by combining the precision of the previous harmonic device with the large vessel sealing capability. For the ultrasonic surgical device is the advanced energy device that uses mechanical energy to seal the vessel and transect the tissue rather than passing current to or through the patient. The resulting vibration produces mechanical friction that generate thermal energy, thereby resulting in extracellular heating, followed subsequently by intracellular heating. The harmonics technology that has been applied in a various open and closed surgical procedure and has become a popular alternative to the electrosurgery technique. For the Ethicon generator G11, so we can see it is a simple device connection with automatic instrument recognition. Generator compatible with the all harmonics and Ensil device. So this model features is powered by adaptive tissue technology, continuously deliver energy intelligently and efficiently in both harmonic and Ensil X1 device to enhance the surgical outcome. So what is the ultrasonic energy? Ultrasonic energy is famously used in the harmonic scalpel. The harmonic scalpel is a surgical instrument that used to simultaneously cut and cauterize the tissue via the vibration. So in ultrasonic device, piezoelectric ceramic disc convert the externally provided electrical energy into mechanical motion via an ultrasonic vibrating blade which act on a patient tissue. So, why are ultrasonic vessel sealing and dissection used? So, as we can see, coagulating and dividing the blood vessel and other tissue structure when surgically removing organs. Second, dissecting the tissue. And also for the third is coagulating and dissect the tissue faster compared to tying structure. Coagulating and dividing the tissue without leaving the object in the body, such as sutures, staples, or clippers. This coagulating and dividing blood vessel and other tissue structure is common procedure in which this is done include the hysterectomies, colectomies, splenectomy, castrectomy, pancreatomy, and also the nephrectomy. Dissecting tissue is to detect the tissue that common procedure. This done include addition isis and dermatrosis in the section. So we go to the next. How do ultrasonic vessel sealing and dissection use? So this device use the combination mechanical vibration and pressure to coagulate and dissect tissue. Mostly use longitudinal ultrasonic vibration, but there are also some devices which produce the torsional ultrasonic vibration. Next is the ultrasonic device. This is how can we see how it works. So there is ultrasonic generator. We send the electric current to the piezoelectric transducer that will change the electric through the ultrasound that will be effect to the tissue. So for this slide, I will explain to you all the functionality of the main components of the harmonics Ethicon. So as we can see this video, for the transducer, it converts electrical energy from the generator into the mechanical motion using the effect of piezoelectric. For the waveguide, they transmit and amplify mechanical motion from the transducer to the blade. So, for the blade is exposed portion of the waveguide that generate the functional heat tissue to induce coagulation and cutting the typically an antinode near the blade tips to maximize tissue effect. For the jaw, compressed tissue against the blade produce frictional heat, induce coagulation and cutting the tissue is impressed between the blade and the jaw. The ultrasonic motion of the blade causes the hydrated tissue to heat up the collagen and elastin molecule within the tissue melt and fuse back together, create a seal level. So you can see from the video. Okay, for the button, the user press it to activate the energy. The energy selector allows user to produce different tissue effect, increasing blade velocity produce, faster dissection with reduced hemostasis, reducing the blade velocity produce, the slower dissection with increased the hemostasis in some device. This is a separate which it others and functionality incorporated into the activation button. So for the rotation wheel, user rotates this to rotate the shaft in the jaw. For the generator, as you can see from this is the rotation wheel. So for the generator here, I show you. This produce the electrical signal which drive the transducer to generate user a control system to exit the system at the resonant frequency for a maximum performance and efficiency. So for the battery power source for the cordless device, visual and audible indicator signal the device status for the cordless devices. Next, a common misconception is that the entire waveguide vibrates back and forth in unison in a reality. So the motion is transmitted as a longitudinal vibratory wave with multiple nodes and antinodes along the length of the waveguide. Nodes are location of minimum displacement, whereas the antinodes are location of the maximum displacement. Displacement is amplified between the transducer and the blade tip by reducing the cross-sectional area of the waveguide near nodes. Who and where the usage of the ultrasonic vessel sealing and dissection used. So the harmonic scalpel used in all types of the open and laparoscopic procedure by the surgeons such as gynecological, colorectal, bariatric, carotid artery, and also the surgical procedure. For the conclusion, it's a harmonic scalpel is a surgical instrument used to simultaneously cut and cauterize the tissue It is the latest device to have been introduced in the last decade or so. So ultrasonic energy is famously used in harmonic scalpel, where the ultrasonic energy is converted to the mechanical energy at the active blade. The main mechanism is the active blade, which delivers high-grade frictional force, while the inactive upper arms hold tissue in a position.